Hello and welcome. I'm Michelle Fox with DentistryIQ.com. This week we'll be talking with Dr. Roger Levin, who is the author of this month's annual practice survey in dental economics. Dr. Roger Plotka shares with us his views on how preventive dentistry works in his office, and Shirley Gutkowski explains why dental hygienists represent the savings in healthcare cost by treating patients with diabetes in the long-term healthcare setting. One of the most requested articles in the year in dental economics is the annual practice survey. This practice survey can be found in the Financial Black Book, a special supplement contained within the October issue of DE. Dr. Roger Levin was the author of this year's survey. The chairman and CEO of Levin Group looked through the hundreds of responses from dental practices around the nation, and Dr. Levin believes he sees some light at the end of the current economic tunnel.
The wonderful finding, and I'm really glad to report, because we're at the American Dental Association meeting where there's a lot of energy now, because we have hit the bottom of the dental economic recession, and that's good news. In fact, as I'm telling you this, we have probably grown in production this year between 4.4 and 5.8%. So we've had some rough years. 2009 and 2010 were decline years. A lot of practices were off in production between 12 and 18% over that 2 years. But now we've hit the bottom, we're bouncing back, and I'm really glad to be able to sit here and report that we're on our way to recovery. Having said that, it's very important to understand, and we surveyed hundreds of dental practices to get this data, that while we're having a better year, we've got a 5 to 6 year probable economic run before we move out of this sluggish economy.
With the upswing of the economy coming, Dr. Levin believes now is the time for dental practices to become very proactive with their management and marketing systems.
Now, 4 years ago, practices were on fire, but one of the reasons they were growing so quickly was the same reason so many United States businesses and worldwide businesses were growing quickly. Consumers were buying. And I've spent a lot of time, Joe, looking at a new consumer purchasing psychology study by a Fortune 500 consulting firm, and I'm very clear that 4 years ago people were buying much more impulsively than today. So what we're finding today that's really fantastic is we're bouncing back, but practices need to be more proactive than ever before when it comes to their management and marketing systems. It's not enough just to wait out the economy. It's important to take steps to move the practice forward, to operate in the best way, and then that 4.4% natural growth could easily become 9, 10, 12, or 14% created growth. And that's exciting to report after a few years of sluggishness.
Again, you'll find the results of the practice survey in the October edition of Dental Economics and see the entire video interview with Dr. Levin by going to the community section of DentistryIQ.com. Dr. Ronald Plotka, a dentist in the Boston area, developed the Mouth Watchers toothbrush and is a strong advocate of caries management by risk management, also known as Cambra. He recently talked with DentistryIQ.com about the benefits of the Cambra model used in the dental office.
Cambra is now taught in practically every dental school in the United States. And what it does, it gives us an opportunity to look at a patient in an entirely different way. Patient comes in with a lot of decay, a lot of restorations. They may be at high risk. So we'll call them a high risk patient. They come in with no cavities, everything looks clean, they haven't had filling in years, low risk, or if they have maybe 1 or 2 fillings, it'll be a moderate risk. And so we can actually tell the patient that we want them to do certain things in the preventive regime when they go home to take them over this threshold of medium, low, or high risk. And so it's a great way to actually tell a patient, just don't go brush and floss. You just tell a patient, you need to do this because you have the bug that causes tooth decay, and this is what you have to do. Just like if a physician takes a blood test and says you have high cholesterol, now they give them a medication for that. Well, what we can do now, we can do an oral DNA test, and this could also be part of the Cambra routine. And it tells us what type of bacteria are present, and we can actually treat the patient if they do have a high level of certain types of bacteria. So it's pretty exciting to me because it's the first time we've ever been able to tell a patient that they do have a certain amount of bacteria, and we like to give them an antibiotic to treat it, and we can control the bacteria that causes tooth decay or gum disease.
Mouthwatchers produces both manual and power toothbrushes with antibacterial properties by using nanotechnology. Here he describes how the brushes work.
Nanosilver particles, not so much colloidal, there are nanosilver, and they're embedded in the bristles of our brush. And when the plaque bacteria comes in contact with the silver, it actually deprives the bacteria of a catalytic conversion that takes place for oxygen, and the bacteria no longer live. So you're actually working with a sterile brush after you brush your teeth and you hang it up. Probably within 3-4 hours, you have a sterile toothbrush. And that means there's no cross-contamination between family members' toothbrushes, which is very good, because there's a lot of caries transfer between family members, and they're not aware of this.
That is very good. His home care philosophy with patients also calls for the use of xylitol products, which also assist in successful management of caries with Cambra.
Well, what we tell patients to do, we tell them to brush before they go to bed, of course. And I used to tell patients to brush after breakfast. Okay? And if they do that twice a day and use xylitol products, they're not going to have any tooth decay problems. And if they carry some xylitol mints or xylitol gum with them, they take 2 of these little mints or 2 gums, which are like 1 gram apiece, after each meal, they're going to change the acidity level in their mouth to an alkaline level, and therefore the strep mutant bug that causes tooth decay cannot survive. So we're actually eliminating tooth decay by over 99% by doing an antibacterial toothbrush and using xylitol.
Insurance companies have projected that periodontal treatment on persons with diabetes will save insurers about $2,000 a year for each patient with diabetes. Shirley Gutkowski, a dental hygienist who is the owner of Crosslink Presentation, believes dental hygiene treatment in nursing care settings would help with healthcare savings. She recently talked with DentistryIQ.com about these savings.
So then I took that little piece of information and I thought, well, what happens in these long-term care facilities where about 30% of the residents have diabetes? And if a dental hygienist was involved in their care, how much money could be saved by having a dental hygienist on staff and treating the residents there? And what I found then is that there are 1.5 million beds occupied in long-term care facilities. And if you take that 30% of that number and multiply that by $2,000 per resident, you end up with a number that will cover the cost of having a long-term care dental hygienist on staff. That turns into billions of dollars saved. It's unbelievable. And that doesn't even include, that doesn't include the savings that you're going to find when you look at things like respiratory disease that dental hygienists have been found to curb, and the flu. Turns out that dental hygiene procedures in long-term care facilities is more effective than the influenza vaccination. So I'm telling you, we are missing a huge boat by not making this information more accessible in total to the general public.
Thank you for that, Shirley, and thank you, Dr. Levin and Dr. Plotka, and thank you for joining us on DentistryIQ.com. I'm Michelle Fox saying goodbye until next week.